Thank you so much for joining us. So this webinar, Innovation and Strategic Leadership in Healthcare, is really about understanding today's challenges and also, what we can look forward to as we go forward. So one of the things, first of all, is just to tell you a little more about the Global Business School for Health at UCL. Many of you, probably all of you, when you were students at UCL, we didn't exist. We're a new school. We're one of the newest departments at UCL. And this school really has been set up to address many of the challenges leaders and managers face in the healthcare sector. But moreover, we're an interdisciplinary department that really operates at that intersection between business and management and health. And as we see, particularly with the pandemic and just in general, as health and the need for health and healthcare expand at an exponential rate around the world for many reasons, things like climate change, of course, aging populations. The pandemic, of course, has put a tremendous strain, but also non-communicable diseases, which, are extraordinary in terms of the number of people, not just in developed countries and high-income countries, but really in low-income and middle-income countries across the world. So the demands on health and healthcare are really important. And though we talk a lot about labor force and the need for labor, and of course we often pitch that in terms of clinicians, we're also recognizing that we need leaders and managers across the kind of health ecosystem. The other thing that's really important is to recognize that as health and the needs of health, and we move more to prevention and look more at diagnostics, the commercial sector is playing a larger role. And so that's another aspect that we need to consider. So all of these things are really integral to the Global Business School for Health and our mission, which is really around, looking at the research and education and doing that in a manner that not only will create graduates that are really interdisciplinary and have that thinking skills and that ability to really bridge the gaps in health and healthcare, but also our wider ambition of really driving forward universal healthcare as articulated in the UN Sustainable Development Goals. So we've got a number of programs at the Global Business School for Health, and we're really proud of all of them. We are exceptionally proud of our flagship program, and that is our MBA Health. And one of our speakers today, of course, is our director of that really prestigious program in our MBA in Health. We also have a mainly online executive MBA Health that we're going to be offering for the next year. We have, of course, PhDs. We have a very unique doctorates in business administration health that is a part-time program, again, delivered mainly online with some block delivery. And of course, executive education, because as we all know, and particularly those of you who work in health and healthcare, you're often very busy. And so having opportunities to have short bursts of learning, whether that's through residentials here at UCL or through some of our short online courses, is really important. And that, all coupled with our research, really allows us to offer numerous consultancy projects. So again, one of the things that I'd really like to encourage everyone that's listening is to visit our website, engage with us, whether it's through a degree program, whether it's through a research project, whether through offering your services as a speaker or a mentor to our students. We are constantly looking for people to engage. And a big part of our ethos at the Global Business School for Health is about collaboration. Collaborating, particularly with those who are driving forward healthcare improvements, across that health ecosystem. So that's really, all I want to say about the school. But I now want to turn to our panel because I'm very excited to have such a group of experts that can really give us insights, not only in terms of thinking about China, but thinking about some of the wider lessons that we're learning in this kind of post or pandemic period. I'm not sure quite where we're at any moment, but we've been through really the last couple of years a tremendous amount of challenges in terms of thinking about healthcare and thinking particularly about the kind of strategies and the priorities that healthcare systems have to make, where they need to be putting resources, and also thinking more longer term in terms of how we reposition for a sector that just continues to see more and more demand. So I want to now take a moment just really to interview all our, distinguished guests. But before that, let me just do a brief introduction. So we've got Kunling Ma, who's the dean. He's a professor and also a PhD supervisor at the retinal division of the second affiliated hospital, Zhejiang University School of Medicine. So very happy to have Ma with us. Thank you so much for joining us today. Thank you. And we also have Professor Julie Davies, who is not only the director of our MBA Health, she's also the deputy director of our School for Equality, Diversity, and Inclusion, and teaches and directs the MBA here at the school. So thank you, Julie, for joining us. And then we have Richard Zihua, who is the CEO and president of Beijing Aerospace Changfeng company. Very happy to have you with us, Richard, as well. And then last but not least, of course, is Chris Hardesty, who's a partner in Pure Land Venture. He's the director also of KPMG Healthcare and Life Sciences and joins us from Singapore. So again, thank you, Chris, for joining us today. All of these speakers will be speaking to you for about 10 minutes, and then we'll be having some Q&A. So I'm going to stop sharing my slides so that we can move to having our speakers speak to you. I look forward to those talks. Before I do that, just a couple housekeeping rules. We are recording this event. And also, if you want to have a question, and I'm really looking forward to having lots of questions from the audience. We've got a number of people online with us today. So if you can look, you'll see you have a Q&A function. The chat function does not work for you and you cannot speak, but you can write a question into that Q&A. So please don't hesitate, don't have to wait to the end. If as you're listening to one of the speakers, you want to ask a question, please put it into that Q&A. And also if you want to direct your question to either Julie, Richard, Ma, Chris, you can indicate that as well. Otherwise, I'll just select someone. So again, thank you so much for joining us. I'm really looking forward to these presentations. So without further ado, I'm going to stop my sharing and turn it over to Professor Julie Davies.
Okay, so thank you very much and welcome. There's around 100 people online, so we're really excited about that. So I'm just going to speak for around 10 minutes. I guess particularly from a British perspective and the perspective of what we're doing on the MBA Health Programme. So our topic is innovation and strategic leadership in healthcare. So that includes social care as well, and tackling the challenges of tomorrow today. So my key message, like Professor Colton, who's just mentioned, is collaborations. It's very important to work with others and also to have an understanding of context, which is why we have experts here today on East Asia. So how do we build systems, leadership and strategic leadership to support patients' needs, to deal with changes in demographics, build networks of communities, and not just digital innovation, but other kinds of innovations to improve efficiencies, deal with these wicked problems of health care and aging, mental health. And bringing together what we're particularly looking at in the UK at the moment is integrating primary, acute, and social care. And all of this is very focused at UCL on promoting SDG 3, our healthy lives for all. And I guess in this current environment of heat, also dealing with climate change too as part of that challenge and looking at innovations. So the three things I'd just like to touch on in the 10 minutes, really definitions. So what is innovation with some examples? What is strategic leadership? And what are the key challenges perhaps of tomorrow that we need to tackle today? So it's very interesting listening to the radio at the moment in terms of what is happening at UCL. So I'm very proud, I think, like our colleagues here who are alumni of UCL and linked to UCL, of the innovations in a top research, world-class research leading university in health, life sciences, medical, economics, many, many disciplines. And today, just on the news, there was this announcement that at UCL, there are some trials looking at gene therapy to markedly reduce bleeding risks in patients with hemophilia B. So it makes me very proud to represent UCL that's making these kind of world-leading innovations. So generally, what is innovation? So Joe Schumpeter many years ago talked about innovation in terms of economics, and he saw it as the practical implementation of ideas that introduce new goods or services or improve goods and services. Other definitions may look at the workplace, innovations in the workplace, and how you can benefit individuals, groups, and wider society. And generally, innovation is about newness, novelty, spreading ideas, and possibly technologies as well. And there are different kinds of innovation, clearly. There's radical innovation, incremental, but also service and organizational innovation. But what innovation means to me, particularly in the context of health, I particularly subscribe to what Eric von Hippel talked about at MIT, and that is end user innovation. Translational innovation, so using methodologies such as community participatory action research, focus groups, learning from patients, and co-production. And also very important, these non-economic innovations, social innovations, green innovation, responsible innovation, and sustainable innovation. It clearly matters because we spend in many countries, 10% of GDP on healthcare, 17% in the US. Big tech companies are investing in innovations, wearables, cloud computing. Even L'Oreal is working closely with Alphabet on extending human life in innovations. But when we talk about innovation, we also need to talk about non-innovation. So what stops people innovating? And we're finding we're dealing with students who are joining us on the MBA Health, who are quite frustrated, or you know, they're in a system, they've been working in a healthcare system for around 10 years or involved in healthcare as non-clinicians, and they want to change the system they're in, but they're trapped within particular career trajectories, they're within particular professional boundaries with licenses to practice, or they're just too busy. So how do we create some slack, some space that they may do at 3M or in other organizations within healthcare settings to cross these boundaries and innovate with patients, co-produce amongst different professionals and organizations, types of organizations? And how do we, on the MBA Health program, develop these T-shaped leaders who are very specialist perhaps in their disciplines, but also very good general managers and leaders. And on the MBA, we're working with people like Mark Britnell, who's produced this various other books on this book In Search of the Perfect Health System, that shows us inspiring innovations in various countries around the world that we can perhaps adapt in our own countries. So I guess we're surrounded by innovations. Thanks to the pandemic, we've seen really rapid innovations in pharmaceuticals, drug discovery, and vaccinations, and how we support behavioral change to take up vaccinations, and various delivery services. So people like Sir Patrick Vallance in the UK, who was able to speak multiple languages in innovating, get on the board of Glaxo, a previous director of the medical school at UCL, very strongly working in government to make sure the vaccinations come through with financing as well. So how do we create those individuals and that time and space to innovate? And we see lots of examples of improvements in patient record systems, booking appointments, telemedicine, apps, and so on. But it's very important that whoever is trying to innovate is solving real world problems, clearly framing and defining problems, seeing things from the patient and customer perspectives, and building up networks and relationships with financiers, nonprofits, venture capitalists, academics, politicians, and so on to see these changes through. And very importantly, also learning from developing countries where cost effectiveness and efficiencies may be far more rapidly achieved than in other parts of the world. Okay, my second point is asking the question, what is strategic leadership? We've seen various challenges. We've seen today possibly the Prime Minister in Italy resigning, our own Prime Minister here resigning. Leadership is very difficult. And it's very important to look at strategic leadership and how you can influence as individuals in teams, share leadership to influence others to make decisions for long-term success while you're dealing with the immediate short-term financial challenges of stability. So how do you grow, innovate, change, formulate strategy and implement strategy, and very importantly, bring people with you? So we see examples at University College London. We generate £10 billion a year in research, business support, and innovation. We see global innovation indices that show that Switzerland, Sweden, USA, UK, South Korea, for example, are in the top 5 countries for innovating. So what makes it successful as a country? China currently is listed 12th in that global index. So how do you sustain momentum when you're dealing with current very pressing concerns? And then finally, I'd like to sum up what are tomorrow's problems, perhaps, that we need to think about today. So Bernard Ma, who's a futurist, has written a book about business trends in practice, and he's looked at healthcare. So he's highlighted preventative and predictive healthcare challenges, how we democratize healthcare in terms of affordability and access. How do we personalize healthcare and make it more precise, digitize? Examples of bio and body hacking using robots and nanobots, data and the Internet of Medical Things. And very specifically in UCL, we have field trips. So for example, we're going to take students with the MBA program to Nigeria, India, and Saudi Arabia. And on Monday, I was just talking to our colleagues in Saudi Arabia, and it's very interesting to see the 2030 strategy there. And the real challenges of workforce and education, Saudiization, and certainly of the 11 pillars. We're going to focus specifically on leadership and culture transformation and workforce and education. So that's my take on innovations and strategic leadership. And I'm very happy to hand over to my expert colleagues in the East Asia region for their views. Thank you.
Thank you so much, Julie. That was terrific and a great scene setter. I'd now like to turn over to Kum-Ling Ma and really get his insights on this very important topic. Ma, it's over to you.
So just I learned a lot from Professor Julie Davies. as focuses innovation and leadership. Actually, I'm a doctor, a nephrologist. When I graduated from UCL and back to China, as every day I face the disease and patients. So just Professor Julia have asked some questions to me. As one is how the demographic change in China impact healthcare organizations. Actually, we know the change of population includes, China is huge as the population huge as so the change of the population includes two aspects. One is growth of population. So the increased population will inevitably lead to the increase of medical expense. The other is change of population of the structure, and at present, the China has gradually entered an aging society. So population aging will lead to an increase in the proportion of social expenditure related to the aging population in GDP. It's mainly manifested with the increase of pension expenditure, medical and health expenditure. This will lead to the continuous expansion of the scale of medical institutions as a continuous of improvement of medical quality. Another is every day you should face perceived changes in patient needs and access. So usually patients go to the hospital is driven by disease, hoping to get physical, psychological, and social satisfaction and needs. These demands may directly affect the diagnosis, treatment, nursing, rehabilitation, and other effects of the disease. Moreover, in recent years, with the development of economy and society in China, patients' health awareness has become stronger and stronger from the traditional passive medical treatment in the past to see a doctor only when the disease is serious. Now it has evolved into the current active and medical treatment, even go to hospital for systemic physical examination. I think this is a great progress and transformation of health concept. So thirdly, the strong community network also are important for the sustainability of the Chinese healthcare system. As we know, as a distribution of medical resource in China is uneven. So in order to establish smooth, high quality and efficient medical network system, the development of community healthcare is very important. Just like its capillaries of hospitals, community healthcare is an important link to solve the current contradictions of a doctor-patient relationship, backward medical conditions, and even resource distribution. It is also the main stopover to undertake the people's pursuit of health. And therefore, is a reform Chinese medical system community health care is listed as a focus for reform. So as medical innovation is very also important in China, especially in terms of digital health. This plays a defensive role in the development and reforms of medical industry in countries of the world, not just in China, which may include not only technological innovation, but also management, business model, system, and policy innovation. And in the past 20 to 30 years, some new concepts such as mobile medicine, internal medicine, internal hospital, digital medicine hospital, informatization, medical informatization, and regional health promotion have emerged and gradually become a reality, especially with continuous integration of cutting-edge technologies in the fields of digital technology and biomaterials. So the fourth industrial revolution represented by artificial intelligence is open a new era of human development. So with the rapid growth of China's smart medical market demand, the boundary between digital technology enabled medical health and traditional offline medicine will become increasingly blurred. The digitalization of digital medical health industry and the medical health industry are expressed as internal and external, and the trend of integrated development is obvious. So traditional offline medicine is gradually evolving into digital networked and intelligent digital health. Okay, that's all.
Thank you. That's really quite fascinating and gives us lots of insights into China. And I particularly found it very interesting the emphasis on thinking more preventative rather than therapeutic. So I'm now going to turn to our next speaker, who will also, I think, give us more context. Richard, I'd like to turn the floor over to you.
Thank you. Thank you for having me here. I'm Richard. I'm a PhD student from medical physics, UCL. I would like to share with you some of my experiences in healthcare, particularly in innovation and strategic leadership. First of all, I think experience really matters. History really matters. Reading history really matters. When I started my career at my current company, I'm vice president and in charge of the healthcare business. And I have a relatively small budget and trying to decide whether I should invest on anesthesia machine and ventilators. It was, I think, 2016. And it was a really hard time because the budget is really small and I have really a bad business number. So I had a lot of pressure. So someday I wander at my university camp and I walk back to my previous lab and I had a book I read on the bookshelf and it was about pandemic. So actually pandemic has a pattern and it has a cycle. According to that book, if I remember correctly, it happens every 10 or 20 years and it has a pattern which hits the community really strong and the disease will become weaker and weaker and then gone, something like this. but for most of the pandemic disease, it will hit the respiratory system. So when I read that, I decided to invest on ventilator. So I actually purchased some of really high-end ventilator lines from Germany, and was I think it's on 2017, and at the end of 2019, I already have 3 ventilators registered and ready to help. I think it's more than 20,000 20,000 ventilator were provided worldwide and save a lot of lives. So I think reading and history really helps, and a lot of solutions and what you call innovations could be figured out from history, from books, from expert opinions. That's the first. Second of all, I think most of the innovations is incremental innovations. Disruptive innovations is really hard to achieve, and most of the innovation you already got a really a strong base, and it's really come in slowly. It was 2008. I was internship at Siemens Corporate Research, Princeton, America, and I was interning there. I remember correctly, some of my coworkers are doing segmentation on an image by learning. So it was that time, big data, AI was not a thing yet. So people call it by learning. It's actually the similar or a simpler version of big data or AI. It's the same thing. You know, AI doesn't come true within a day. You know, it has been there for more than 50 years. So you don't say AI is a disruptive innovation to the current healthcare system or current technology system. AI has been there for more than several decades. So you have to pay attention to these incremental innovations before it came to disrupt your current business. So thirdly, I would talk about healthcare, especially what pandemic has changed the landscape of healthcare, especially in China. Before, if you walk into a hospital in China, it's always been crowded. It's really hard to get attention from a doctor because the people can easily pile up, and doctor can be really busy with them. But now the pandemic happens, and most people turn to digital healthcare for help, and it worked out. And I think pandemic not only it changed the way how we live in the current society, but also changed how healthcare system, push it forward faster to digital healthcare. But what I would like to say more about digital healthcare is it will not change much if we do not quickly provide them more equipment, because digital healthcare only link patients to doctor in the easier way, a more comfortable way. But home care equipment are not ready. For manufacturers, we are not ready to make them yet, and we're not clear because you do not shrink CT or MRI or DSA into a smaller size and let patients to operate on them. You have to provide them a more suitable equipment, and it's not defined either in concept or in technology yet. But I think people have become more and more to realize this task and working on it, and hopefully some of the new equipment will come to the market soon. And the other thing I would like to talk about is that I would like to share with you my experience in managing a healthcare company. I would really straightforward. It was not easy because, in most of the cases, you cannot have an innovation and innovative solution solve most of your headaches. For most of the tasks, it's just tedious work. And I think for most of my time, what I spend is trying to figure out what is the true situation. Because that was very hard part. Because for most of my direct reports, what they are reporting, for most of the cases, are not the real problem. If you respond to them based on what they say, you probably will not solve it. So as a leader, you have to have the ability to figure out what is the real problem. You probably have hundreds, thousands of problems at your desk, but you have to figure out which is the one that you solve will help you solve the other problem. So you have to have this kind of ability to solve the problem, really pushing the company forward. So some of the time it's not innovations, it's just the capability to analyzing it, either based on your experiences, your knowledge, or your casework at your MBA. All matters. And the key I think for driving a company to move forward, what I call is the value-added management. You cannot just manage a company, just respond to your direct report saying yes or no. You have to add value to your colleagues and to empower them and to give them more power, more solution, differentiation. And then if you think about yourself as a CEO, it's not replaceable. You have unique selling point. I think you will be successful in your career. Otherwise, you're gonna see problems. So I really appreciate the UCL alumni for inviting me here, because UCL really add value to my knowledge and to my experience. And my experience as PhD student is really some memorial time for me. Thank you very much.
Thank you so much, Richard. And that was really fascinating. And I couldn't agree more with you about the importance of capabilities. We can't solve everything. Health systems are extraordinarily complex. So it's really is figuring out what your contribution will be. So that leads me now to Chris Hardesty, who's, again, as I mentioned before, joining us from Singapore. So Chris, it's over to you.
Yeah, thanks, Dr. Colton. And just to check, you can hear me okay? Sorry, I think my internet's a little bit wonky here. It's okay?
Yep, that's fine.
Okay, just let me know. Greetings to everyone, and also great to be here with the distinguished guests, and always nice to collaborate with UCL. So as Dr. Colton said, I'm a visiting professor at UCL in the Global Business School for Health. And then I wear a few other hats as well. So I'm a partner of a health tech VC, so looking at early stage innovation, particularly in the Asia Pacific region. And then as a director of the KPMG health practice, I'm involved in a lot of policy matters like healthy aging, universal health coverage, and even digital health. So what I thought I would do in the essence of time, I know there's already some questions coming in on the chat, is just kind of share three things that really occupy a lot of my work at the moment in the Asia Pacific region, and happy to then elaborate on those further either during this session or people want to follow up after. So I would say the three main things with respect to the theme today for me are, you talked about universal health coverage, or UHC, at the beginning, Dr. Colton, but we're promoting a program now in the Asia Pacific region, what we call UHC 2.0. And that's because if you look at the populations in this part of the world, while we're all in this aging journey, as with many places around the world, the amount of time that these countries have spent in middle to upper developed economic status is much shorter. Therefore, the dividends that they can harness, economically speaking, before the population ages is much shorter. So we're looking at alternative models for UHC. If you look at, like, for example, taxation schemes or social, employment contribution schemes, a lot of these just don't apply due to the factors that I've just said. There's some work going on with the World Economic Forum on UHC 2.0. I can share the link earlier. I won't go into all the details, but one thing that's been really interesting for me during COVID is what I would call healthcare literacy, or people's activation and energy level around healthcare. And one of the questions in the chat was people's trust. about things like medications. But I think in a lot of my work, the fact that people are much more knowledgeable now than before has been really game changing. So anyway, that's one thing for me is alternative models for universal health coverage. The second thing is we talk a lot about innovation, but then I work a lot on access to that innovation, because just because we have great ideas is by far from it being able to be deployed and adopted. And so a few things that are very hot right now are taking the concept of health technology assessments, HTAs, obviously deploying those into the countries and training governments on how to utilize those tools. But now we're getting into the point where we want really specific HTAs based on specific disease areas, because they're all quite different from each other, from vaccines to rare disease, to digital health. And so that's quite interesting. We're also working on a lot of like value of areas. So just finished some work with the Lancet Commission on value of diagnostics, for example, because diagnostics contribute to about 70% of clinical decision making, but get about 1% of the expenditure bucket. So we're trying to better articulate the value stories of some of these innovations in order to get more of the financing. And lastly, related to access to innovation, I'm working a lot on new regulatory as well as reimbursement schemes for digital technologies, particularly software as a medical device, which is regulated but can be decentralized in terms of its deployment. So again, happy to address anything there. Lastly, in terms of my third item, just stuff I'm working on and related to the theme. So this is a leadership session. I went back to my notes. Actually, I was part of like this crowdsourcing initiative during COVID, where we got about 1,000 senior healthcare leaders on a Zoom at the same time during COVID. It was kind of right in the middle, and just to share what everyone was doing and how we were progressing and what was important to people. And some of the themes that were there was, one, the idea of making planning more modular. So continuing our corporate government, health planning, but making it more modular, just because of so many variables happening these days with climate and disease and population shifting and whatnot. Another thing was partnerships. So a lot of leaders are looking for not only traditional public-private partnerships, but also non-traditional, whether it be working with banks or transport companies or tech companies or media companies. There's a lot of opportunities there for new partnerships. And then lastly was just about the people aspect. And I think one thing we tend to overlook with a lot of the technology and innovation is, at the end of the day, healthcare is a very people-centric operation in terms of the workforce as well as the patients. And as you would know, in the UK, there's a lot of stress on healthcare workers right now. So I think more needs to be done in that sense too. And Professor Davies kindly called out the KPMG, Dr. Britnell, a book about how to in search of the perfect health system. There's actually a second book, which is specifically about the healthcare workforce and the fact that we're already short about 17 million healthcare workers around the world, and just need to kind of think a bit differently about that. But anyway, maybe I stop there, Dr. Colton, and I know I don't have a lot of time left, so I hand it back to you. Thanks.
Great. Thank you so much, Chris. That was really helpful, and really highlighted a number of very important points about innovation. So hopefully we can get back to that. So I just want to start out really and go back to Ma. Ma, one of the things that, of course, around the world we hear a lot about is the demographic challenges in China, particularly given that you've got a very large population that's starting to age, and a smaller youth, coming up through society. So how do you think those demographics, and of course there are other demographic variables that we hear about in China. Often we hear about kind of the rural versus the kind of urban divide, and the impact that has. How does all of that, those demographic changes that China is starting to see and will continue to see at a much more rapid rate, how do you see those impacting healthcare organizations? And maybe some thoughts on how the health system might go about mitigating those challenges.
Yes. It's in China, it's a huge population. So the hospital and the government have faced these questions, need to increase the investment for the hospital, for the instrument to to meet the needs of the patients. So as one is the growth of the population, another is structure, especially for the aging society is coming for in China. So so you have to increase for the healthcare to increase the expenditure for patient for the medical and healthcare expenditure, and to gradually to make a greater progress and to solve the problems of the patients for the medical treatment and lots of things.
Okay, thank you so much. That's very helpful. I want to now turn to Professor Julie Davies and really ask you this question. You know, you articulated some really powerful ideas about leadership. So how can healthcare leaders ensure that primary healthcare and Chinese medicine drive forward efficiencies while meeting the health needs of the people of China?
Yeah, well, I think there are examples in lots of places in the world. For example, there's the Dutch model of home care, of where you have nurses working independently, for example, Buurtzorg. So certainly in the UK, we have huge issues, as Richard mentioned, about overcrowding and particularly in emergency departments. So if you can, on the one hand, get flow through emergency departments with social care, sorting out social care and neighborhood and connections in the local community, making sure, you know, elderly patients are looked after by their children and their community, you can get people out of hospital faster. But also, obviously, the key thing is not to get people into hospital at all, ideally. So if you can treat them, in the UK, we've got the whole load of urgent treatment centers, same day emergency care, treatment at home, as you said, with a kind of having medical devices at home, telemedicine. So it's about ensuring that patients get the right service and the right treatment in the right place. And Chinese medicine, as well as Western medicine, if you can apply that with paramedics and other clinicians servicing people at home and in the community, then you can reduce the pressures on beds and the workforce in the acute sector. So I think it's very important to see healthcare as a whole, community, primary, non-Western medicine, Chinese medicine helping, and family and other support mechanisms.
That's great. And I couldn't agree more. I mean, it's really thinking about it systemically and really understanding that whole, which is so integral for the future of healthcare. Richard, I'd like to come back to you and just, you know, you talked a lot about innovation. You of course talked about your own you know, work in that area, but you know, a lot of healthcare innovation, as we know, and I think Chris alluded to, you know, often doesn't actually get embedded into health systems. So in terms of China, what do you believe is the real impact that digital health is having, and how do you see that being embedded?
Well, I think you are absolutely right. I mean, in healthcare, healthcare is really a different area other than mobile car and other industries, and it's different. It's really different because our way of innovation is different, and for some of the innovations, it came from technology. There's a technology breakthrough as supposed to do some good to patients, and we started to pair them up and to form equipment and have we test on first on animal and then on patient, and if you pass a statistic number, you get your equipment registered, and there is a post-marketing analysis to see how much of the benefit you get, and the larger number of benefit you get, and you can become really a frontline treatment. So that how it works, because some of the innovation, because for the healthcare system, an innovation may take like 10 or 20 years to get them validated. It's really a long time period, and for that long period, and you cannot really foresee the outcome. So it's really hard to foresee how much benefit you will get, because just from the technology, and you test it on a very sophisticated body system, you cannot foresee it. So that's the difficult part of innovation in healthcare. Second of all, you mentioned how the digital healthcare has changed to the society, because there are several digital innovations in China. The first one I mentioned earlier is there are some societies who bring doctors to before monitors, so they can talk to patients directly. And secondly, there are a lot of mobile industries. They are doing a lot of work on their watch. A lot of what's the word? Body bell numbers could be tested and online feed back to the cloud, but nothing could be done about it, because there is no right way to treat it, because the hospital are not ready to receive those data and the feedback to them, because they don't have the proper ways to treat them, because they always treat patients face to face. They're not ready to analyze the data yet. And the second of all, because the data is too big, and it's really hard for them to analyze. But that's why I say you have to have certain equipment ready to be implemented in the healthcare, in the home care system. That's first thing. Second of all, I think one thing which is missing is education, because the current healthcare system, in the current healthcare system, that the way to treat patients is not unique. For some of the hospitals, they treat patients in one way. For the other hospital, they treat patients in another way. And that's why I say doctor education is hard. You can imagine those people who are already educated in a PhD or doctor traineeship for 4 or 5 years, and you cannot tell them how to treat a patient in the same way, and how you're gonna tell your patients at home to treat themselves in a unique way. And so that's a big problem to educate patients to home care themselves at home. So it's not just equipment, it's a systematic way how to think about it. So I think that a lot of things have to figure out before we really make a big through to change the way how we live.
Yeah,
thank you.
That's really thankful. Thank you, Richard. Really excellent insights. So Chris, I want to bring you back in, and lots of talk about innovation. We hear lots of talk about digital health, and I think Richard's highlighted some important points. So you mentioned when you were speaking about health assessment and how we go about that. Given that it can take, and Richard was kind enough to say 10 years to embed, an innovation into a health system. I think the stats I see, it's more like 17 to 30 years to really embed an innovation into a health system. So can you talk to us a little bit about your work and experience around assessing technology. How do we know what technology, what innovation should we take forward? Should we be experimenting and trying everything, or show, this is about strategic leadership? How do we set the priorities?
That's great. And I know we're running out of time. I've been typing answers to the Q&A as we go, because there have been some questions along this and related to some work. So I've been kind of typing that out. Personally speaking, in a lot of my work and in the circles, I would say we take a bit of a Goldilocks scenario, which is, we don't focus too much on the totally unregulated, pure software kind of B2C applications. And we try to differentiate digital health, what I'm talking about, versus like a classical medical device, right? So we try and kind of be a little bit in the middle there. And what I also try to always tell people is to differentiate between regulation and reimbursement in terms of where the trickiness is, right? Because where I think we've made a lot of progress in the Asia Pacific region is regulation. We can differentiate from an approval perspective, a medical device from a digital health technology. We're adopting the German model of building sandboxes so that these technologies can be rapidly deployed, gain the data, prove themselves before an official evaluation is done. So I think a lot of those pathways have been created, which is nice. I think where things are still very tricky is on the value assessment aspect from a reimbursement perspective, because we're trying to work with governments to think more holistically around not just clinical and economic outcomes, but also things like user interface, consumer experience, workflow impact of these digital health technologies, cybersecurity, right? And we're just not quite there of actually changing the reimbursement model. So still the way things are being done currently is we get things approved, the proper channels in terms of digital health, because a lot of those mechanisms have been set up, but then the actual financing still gets devolved down to like a hospital or a clinic or a doctor level, where you basically use the same charging code structure, or you ask people to pay out of pocket, swapping out, let's say, a traditional service for a digital service. So we got a long way to go in the ladder, but we are making progress. So that's my quick answer there. Thanks.
Great. I want to go back to you, Mao, and ask you about this whole question around data. So we often hear and there's a question in the chat about that as well. Hospitals have a lot of data. How in China do you see that going forward in terms of hospitals' abilities to really share, to have electronic health records, and how can we harvest that data to really improve people's health? Do you see that as something in the short term, in the long term? Is that still very much far away in terms of being able to use health records and historical data to really make a difference for healthcare in China? Mao, did you hear my question?
Sorry, ask me.
Yeah, I just wondered what your opinion is on, health records, using data from, hospitals have a lot of data on patients. How is that data being mined and used to create better health outcomes for patients in China?
Yeah, it's now it's era for big data. So as in China, especially for the artificial intelligence is now applied also is a medical system. Many people is using technology for AI to combine with medical system to try to summarize and collect the data to service for the clinical work. For the clinical works also solved a lot of problems for the patients. Others using digital technology for lots of offline and online medical medical science and to for the diagnosis and treatment for the people.
Okay, thank you so much. So that really brings us to the end. I just want to finish off with one last question, and I'd like to pose that to you, Professor Julie Davies. And that is, one of the questions in the Q&A is about how the pandemic in particular has created an environment where people don't have the same level of trust in health and healthcare that they have historically. The person mentions particularly medication. As we've seen, we saw a whole movement around vaccinations, people very suspicious of getting COVID vaccines. How as health leaders, do we build back that trust in our healthcare systems in this post-pandemic period?
Yeah, I think it's very mixed vaccine hesitancy. We saw Novak Djokovic winning Wimbledon the other week, but he can't go to the US because of his hesitancy and his refusal. And so I just put up an article from the Nursing Times actually about, it's about education, constant communication, understanding other people's points of view. You can't just impose your point of view on other people. But I think what a really tricky situation is if you really don't trust the quality of the medication being given you. So if you're, you don't even trust that this is a paracetamol tablet. I've heard of people living in certain parts of the world who go home to expatriates, go home to the US and stock up on medications that are, they know are the right medications before they go back to another country. So I think it's about constant communications, public health, and understanding other people's points of view, and collaboration, I think, is where we started this session, working alongside people rather than just telling.
All right, thank you so much, Julie. So last but not least, I just want to thank all the panelists, Richard, Mao, Chris, Julie. You've been fantastic, and I've really appreciated you really sharing your insights with us today. I think there are no easy answers. Health systems are very complex by their very nature. The world we live in is full of uncertainties, and we see lots of changes. So as important as looking back and thinking about our history, we have to also now be in a position to look forward and think about our future. So I think this has been really good food for thought. It's taken us beyond just thinking about digital health, thinking about patients, and thinking about leadership. So again, thank you so much. I appreciate all of you. And moreover, I appreciate all of our fantastic audience who joined us, who have engaged in the Q&A, and a big shout out to Chris in particular for taking over and making sure to proffer some answers there online. But again, if you've got more questions, if you want to learn more about the Global Business School for Health, please, visit our website and learn more about us. We've got some really innovative programs. We are really committed to this space, to making a difference. We can't imagine a more important moment in history than we're in right now for really embracing and having that moment in thinking about how we can really contribute, not to just our own lives, but to society and to making a better place for all. And I think health is definitely one of the key areas that those of you who are on the call, who are thinking about doing a degree, please think about joining us, joining our community of academics, students, professionals. We really believe very strongly in that word collaboration and bringing about a community that can really help address some of these very pressing problems that we all face, not just China, but worldwide. So again, thank you so much. Have a lovely evening or afternoon, depending on where you're at. Thank you.
Thank you. Bye-bye.
Thank you.
Bye.
Bye.
Thank you.
Bye. Bye.
Bye.
Bye.